Welcome back to Talk 1260 KTRC, the Humanity Behind the Vanity. You're listening to Dr. Daniel Ronel, that's me.
And me.
And my wife, Betsy Ronel.
Me. It's all about me.
Talking about the realities of plastic surgery.
We just talked about Kate Hudson's small
Natural breasts.
little bosoms getting just a little bigger, but still in a natural way. She looks
How
good.
thankful I am that people are liking natural breast augmentation.
Right.
You emailed me an article this week. I think NPR wrote it. I thought they were just a radio, but apparently they also
It was
write things.
about a show that was on the NPR station.
Oh, okay. And it was about something that's very interesting that I've known about for a while.
Which the public does not know about, because
Yeah.
I certainly never heard of it.
As we age, the bones in our face drop also. It's not just the skin and the collagen, but people who have known this for a long time are the Natural Museum those people in the Natural History Museums who preserve
skeletons.
Skeletons. I mean, it's well known that a youthful skeleton has high cheekbones, and the bone is much stronger.
Any medical examiner can also tell you that.
And as we age, it's not just our skin and our collagen that becomes lax. It's in fact, the jaw drops and becomes more of a slack jaw. It drops and it goes anterior a little bit, and the cheek
drop.
prominence, the malar eminence, it's called, drops down. What does that mean?
Yeah, what does that mean?
What that means in terms of plastic surgery is a facelift is not going to work for a long time if it doesn't address those anatomical things. You've got to lift up the deep underlying structures of the face.
So what's
You don't have to lift up the bone, but you have to lift up the layer of collagen and connective tissue right above the bone, and there are a lot of sort of gimmicky names.
Wait, what's that? There's a commercial
facelifts.
every morning, because I watch the housewife shows, like Today's Show, which I love, and The View and all that.
Yeah.
I swear to you, other than that silly Pima Medical Institute commercial, which irritates me to no end, every 5 minutes we'll be back, this is how loud, you won't see me again this morning. I made a joke on Facebook. I said, if I see one more Pima Medical commercial, I am going to call up Pima Medical Institute every 10 minutes and let them know what I'm doing. Give them an update. Anyway, sorry, I just had to say that. Nothing against Pima Medical Institute, but your commercials stink. Okay, so anyway.
One of my best medical assistants is a graduate of Pima Medical. Proud graduate.
So was one of your most troublesome ones. Okay. Anyway, okay. But it's nothing to do with the quality of education. They need a better quality commercial. But okay, anyway, but the other types of commercials I see are for something, I think it's called the lifestyle lift.
Yeah, sure.
What's that? Because that definitely is just a Band-Aid, in my opinion.
The lifestyle lift was started by an ENT who came up with a way of lifting mostly just the skin around the ear. And if you just do that, it's almost like taking out a skin cancer, which I just did today.
Oh.
And it's a superficial operation.
That's
Does
why
not
it's so
involve
quick.
the deep tissues. It can be done in the office under local anesthesia.
Right.
The recovery is quick, and the results look great for a very short time.
Right, it's not deep, you're not going in there.
Right. Now, there are some lifestyle lift people who do go deeper, but that's not truly lifestyle lift.
Right.
And the problem with the company is that it's sort of a factory. There's a clinic in Albuquerque with actually 2 good surgeons in it, but it's not really, it's part of a chain. It's like the difference going to a chain restaurant or a regular restaurant. And it is a chain. There's about 30 centers across the country.
Right,
and
it is a chain.
They actually got into a lot of trouble. The state of New York sued them and they won because they were doing false advertising.
Not the one here in Albuquerque,
not the
in
one
New
here in
York.
Albuquerque, but the one in New York. And I've seen the ads. They look great.
But they don't. You know what? I'm a partially educated consumer in this. And to me, I'm like, yeah, right. Quick recovery, go out that night in the office for a facelift. Give me a break.
If it's too good to be true.
Right. Then it is. Buyer beware on that one.
Right.
Yeah. Okay.
Right.
So anyway, so how do you
I'm
address this? You're not a fan of that kind of a lift.
I'm not a fan of that, right.
What's another gimmicky type thing?
There's something I think called the quick lift, which
what's
is
that?
similar, but I'm not sure. It sort of depends on what part of the country you are. Lifestyle lift is nationwide, but each different part of the country has different fancy names. There's so many things you can do to the face. You can do laser, you can do a platysmoplasty, which is tightening the neck this way. You can do thread lifts.
Tightening the neck this way, he means tightening that little sort of turkey neck we all get.
And I'll talk about it in a second.
And the bands.
And so if you combine them, you can patent it and call it the laser trampoline lift, for example, or something, which is,
Right.
I mean, these are all techniques that we've all used, and if you package them a certain way for a certain type of patient, it looks great.
It's just marketing.
Right.
Right.
I think it's very important to address the fundamentals and you modify them. There are a lot of people who have a very loose neck, and I do the quote famous trampoline lift in LA, which is what it's called now. All it is when you sew the two muscles together and it looks like a trampoline when you buttress it up, and that's a great way to tighten the neck.
Yeah.
You don't have to do that with everybody, but with some patients you do.
Right.
So, and then obviously if you're using a laser to tighten up the skin, that's a nice adjunct also. It
Yeah, I
doesn't
like
replace
that.
a facelift, but it's adjunctive to the facelift.
No, and no dermatologist, ENT, anyone who does other things other than a true deep plane facelift will tell you. They will all tell, I don't know what I was about to say, they will all tell you nothing replaces the true deep facelift. Nothing.
Right.
You can do
many
other things
people,
in the
right,
meantime.
many people don't
Right.
need it. Women
Right.
in their 40s,
No,
they
no.
don't need sometimes
Right.
an invasive facelift. Although those types of facelifts the modern facelift looks fantastic on a 40-year-old because it's a very gentle procedure. So anyway,
Okay.
the point is about this article about the bones dropping. The point of that is in order to really address the face, you've got to address the deep layers too. The muscle layer, it's called
Supporting.
it's called the SMAS, the submuscular aponeurotic system. You have to lift up the SMAS in order to make a lasting facelift, not just the skin.
Right.
In fact, there are some people who actually go deep onto the bone and do a periosteal facelift, and that's a little bit
What's that?
too barbaric
What's
for
that,
me.
craniofacial? What is that?
That's very intense. It's
Who
when
does
you
that?
actually there some doctors who are very well trained. There's a high complication rate in terms of bleeding and nerve injury, but I mean, talk about shifting the bone up. They actually do go into the bone and they lift it up.
I mean, that sounds like craniofacial surgery.
It's practically craniofacial surgery,
Whoa.
yes.
I bet you they did a thing in craniofacial.
Okay.
You know,
Right.
a thing. What is
Yes.
that called? A year-long thing?
A residency or a
No,
specialty.
the specialty.
Fellowship.
Right, fellowship. Right, that's what I meant. Yeah, okay.
Right, well,
Whoa.
we did a lot of craniofacial surgery where I was trained and I would never come home on time because we always had these very intense craniofacial phases.
But I learned a lot testing him for his boards.
Yeah.
It's fun. Anyway. Yes, so, okay, but here's my question to you about saying women, because it used to be the average age for getting your first facelift was sometime in your 40s. It used to be. Maybe it still is, I don't know. But now we've got these fillers. Like, I'm, going to be 40 this year, and my face is full of fillers. I definitely do not need a facelift right now.
Right.
And if I continue this filler action, and I keep continuing,
You can stave it off, absolutely.
Right. I mean, I'm all for a
That's
facelift.
what the liquid lift is marketed as,
Right.
is something to help hold off a facelift.
I mean, and if you keep taking care of your skin quality.
Right.
Yeah.
Okay, we've got to wrap things up.
All right, just quickly summarize it. Conclude what you're talking
The
about.
summary of what we're talking about is this article showed that the bones droop with age, and that leads me to say that if you're going to have a facelift, you have to have an anatomically correct facelift, which lifts the deep underlying structures of the face. And that's going to look good and last a long time.
And that's the true facelift. You can have other things. They're just not going to last. And it's fine. You might not be ready psychologically, financially for a real facelift.
Thank you very much for listening to Talk 1260 KTRC.
I can just go on and on. Can't I?
This
Do
is
my
the
own
Humanity
show.
Behind the Vanity. Dr. Daniel Ronel and my wife Betsy. Stay tuned. We'll see you next week.
And go to Fetchapalooza this weekend. Look it up online. Fetchapalooza, get your news all.
Okay.
Thanks for listening.
Bye.